expressing interest by sending an email and letting me know that you were interested in having participating with a presentation, whether it was for today or for the December call next December the 8th. You still have time if you're interested to send me an email, and that would be for the December spot or further 2021. You just let me know according to our availabilities, and I'll try to accommodate as we can. The agenda for today, we have some highlights from the years past, the 2019 and 2020 annual highlights report. It has been a tradition, as I have seen, that every year there is this annual report that really highlights the accomplishments of the work of the organization, the staff working, serving families with all the help of the stakeholder partners. And it came to be just as I came in as the third director. So we were able to dig out the data and present it in a way that hopefully will be very easy to read. I'll show you where is that in our website that David has uploaded for us, and you can browse through it at your leisure. We also are going to be hearing from Angela regarding the Chula Vista Welfare Council. You know that Angela Thomlinson is our project manager for the FRCs, the Family Resource Centers, and she's also part of the Welfare Council, and will give us some holiday season updates on that work. Then we will move on to our presentations by partners, and we have the three main presentations. Thank you for not only presentations, but we are going to have some associated handouts with those that we're going to upload on our webpage. And we'll finish up with some announcements and some of your needs and challenges that we will want to address by the end of the call, and the announcement of our next one on December the 8th. Just as a reminder, our FRCs are open, the 5 of them, and we are servicing our families by appointment mostly on the phone. And there are some cases that we do need to make appointments on location, servicing through a window, all the precautionary measures for the safety of staff and our families, with the barriers, the mask, the disinfecting, monitoring symptoms, washing hands, limited access to common shared areas, all the lot, but still working in servicing our clients. And in that spirit, I wanted to share with you, that's the link on our website for the highlights of 1920 until June. And even though that I started on July the 1st, I did want to include a grateful farewell words from Margarita Holguin, my predecessor, retiring director. And you can get to read that on the annual report. And that is a picture of time passed with everybody together. And hopefully soon we'll get to do a group picture of all the staff together again without worries about our safety. But that is a good look at what happened. Just a quick highlight, those earlier 9 months of that fiscal year was very, very productive. The collaborative was on the road to surpass the numbers of previous years in terms of servicing clients. And then the pandemic hit in March, so that last quarter from March to June, the numbers really reflected what was going on around, and still we were able to serve the families in a reduced schedule and just a few of the centers open. But nevertheless, as we learned, just like with everybody else was learning about the pandemic and how to do business within the new context, the collaborative led on and continued the work and then I joined in July the 1st. So just honoring here the work of the team, the work of the staff, the work of in conjunction with our partners, and of course under the leadership of the previous director, Margarita. Again, my hats off to her. And for better or for worse, right? COVID has changed our lives, and we still have that holiday season spirit that we do want to honor those commitments that the collaborative has been known for years. Even though that we are facing now more complex family problems, mental health issues across the board, adults and youngsters, we are really looking forward to celebrate in a modest way and try to serve, if not at the same scale as before, but still making some collections, partnering with other organizations and donors that can help us fulfill this commitment to our community. And basically is the same as before: food insecurity, and assistance with programs, referrals, and also specifically for the holiday season, food for Thanksgiving and the holiday period, and a modest Santa Shop and Adopt a Family program this year. We will be sending out this week profiles of the Adopt a Family for the usual donors and other organizations to paint a picture of some of our most needy families for one reason or another. And those donors will be able to select among those profiles and fill this, communicate with the family, and fulfill those needs in December. Santa Shop, this will also be on a lower scale on numbers with children and adult items because of the safety concerns and all that. What we are really hoping to get more is gift cards for the teenager and adults, and then of course the little kids up to 5, 6, 7 years old. We still are collecting toys for the Santa Shop activity. And you will see several flyers going around as we partner with other organizations, and Angela is going to tell us more about that in a second. But definitely the incoming need is the Thanksgiving food donations and the distribution to our families. We are receiving baskets of items for, we are putting together those baskets, if none are ready. We already have a commitment from our friends at the Chula Vista Sunrise Rotary Club for some of those Thanksgiving baskets that have a complete meal for a family and a gift card for them to buy their turkey on their own. We're trying to minimize risks of our staff with all the managing and kind of coming together to put together those items. So that's why we will rely a lot on monetary contributions in lieu of collecting much stuff. And still, we do have a contactless drop-off that Angela is going to tell us about for this weekend. Hopefully, we can put all this together by November 13, and we'll be distributing in our FRCs in the week of November 16 to 20th for those selected families that each FRC. Thank you for the support. And I invite Angela to tell us more about what we're doing, what our current needs are, and basically speaking on behalf of the Chula Vista Welfare Council. Angela?
Yeah, hi. Good morning, everyone. Everyone's doing well and staying safe. I just wanted to share a few highlights on what the Chula Vista Welfare Council is doing right now. We have had already 2 toy and emergency food drives. Our next one will be this Saturday at the ESD district building, which is 84 East J Street in Chula Vista, from 9 to 12. It is all contactless. We'll be just in your car. We'll have volunteers there that's able to receive the items from you. We are looking for toys, unwrapped toys for children from 0 to 10, and gift cards for the teens in our family, for our families. Some of the items that we are needing that we haven't received as many from our last 2 drives are rice, pasta, peanut butter, and cans of tuna, or meat like canned chicken or things like that. We also appreciate any type of check or cash donation. That way we can have it directly for Santa Shop in our client fund, and we're able to buy either, toys or gift cards that would be missing for the age groups that we'll have for our Santa Shop. If you are able to have any coats or jackets for donation, we do have a closet at Rayo de Esperanza site. This site has a closet that supports the families at CVCC. Whenever they need clothing, they can go in. Of course, we're working with the precautions with COVID and everything, and sanitizing. But we do want to keep our closet available for families, especially right now during the crisis. We really feel like we need to support them in case they need clothing, and we're starting to get, the colder weather approaching. So thank you for your continued support, and please feel free to stop by or drive by safely on our event on Saturday, this Saturday again from 9 to 12.
Yes, thank you for that, and Angela. And I will be including, actually, David will put together all the attachments for this call, and in there you will find the flyer with all the specs and address and location, even a map as part of that flyer for this November 14 event. Thank you. And hopefully with that will complement some of our current needs to create this bags for full meals. I know that we have gotten, the ketchup and the barbecue sauce, but we also need the protein that goes with that, right? And kind of more of a complete meal. Think of it like if you're putting a meal together for a family that you want to bless as well as you are. So thank you for that, Angela. And I hope to get and complement some of the goodies we already have received with what we need, or also as a way to complement that, maybe gift cards. And also, if your organization is putting together a drive-through or another food distribution event, share the information with us, because we also share that with our families. We're not only, I'm so glad to see that we're not the only organization that is putting food distributions together based on donations or purchases. But actually, if you do also have an event coming up, please share that information with us, and we'll disseminate accordingly through our networks. We welcome the information sharing. And now to the real meat of these collaborative partners. I really have heard so many good stories about the face-to-face meetings where everybody gathered, said hello, share a hug, and tell stories, share a cup of coffee, and even have raffles. So those times now have to be kind of in a hiatus. For the moment, we're doing this virtual meetings with the presentations and follow-up handouts and materials. But nevertheless, I do want to keep a little bit of that spirit. I'll be preparing a survey to send to you all with a link, kind of like SurveyMonkey type of survey, very light, a couple of questions regarding your input on the next move forward and how you see the collaborative morphing or adapting to our new environment. We have had several months under our belt now in this situation, and we do need to kind of start planning for 2021 after the holiday season. So along with the links for this meeting, you will receive a link for a quick survey and hope to give me some input and guidelines and direction on how to move forward. I have been doing individual phone calls, one-on-ones, meetings with several of you, and I do plan to continue doing so as we move into our 2021. And for that first quarter, I would like to get more specific feedback from our stakeholder partner organizations. So look out for that. And for today's presentations, we have three, and let me get out of the presentation mode so I can put our next speaker on with Monica Leyva, and that is Understanding Cover CA Insurance One-on-One. I have, can you see our slides here? David, can you confirm? Understanding Covered
Yes.
California? Yes?
Yes, we can see it.
Okay, so I'll put it in slideshow, and please, for the main speaker, just let me know when to go to the next slide.
Sounds good. Can you hear me okay?
Perfect. Thank you.
Okay, good morning, everyone. My name is Monica Leyva, and I work for HealthNet's Covered California programs. I do community relations. Part of our work is to work with community organizations, nonprofits, and schools to educate our clients on their benefits and health insurance. So now that we're not out in the field answering questions from families, we have gone virtual. I just wanted to give a couple of updates since it is open enrollment and since families may be asking questions regarding health insurance right now. So we can go to the next slide and we can start. So our purpose here at HealthNet is to transform the health of the community one person at a time. We do have Medi-Cal, Medicare, and Covered California programs. Next slide. With COVID, I just wanted to give a couple of updates with Covered California. These are reports that we got from Covered California and from HealthNet regarding some of our services. So this year, health plans did help waive COVID-19 related costs for Medicare, Medi-Cal, and Covered California members. They also helped by eliminating copays and removing authorization requirements for related treatments to help that process go faster. They also had telehealth services covered until the end of this year to help those families still receive services. Covered California also was reporting that the process was going smooth when community enrollers were enrolling and enrollers. So it was taking as little as 30 minutes sometimes to help these families apply online or through the phone. So I'm really grateful for the community workers that we have helping those families during this crisis. Also, they were reporting that over 300,000 people have actually signed up since March because of COVID and some of the families that were losing their jobs or health insurance. So what's important today is I just want to let you know that it is open enrollment. It did start November 1st. So for families, right now is the time where members can sign up for new healthcare coverage or change existing healthcare coverage. So if they're looking to see what's out there, if there's something less expensive or if they've had changes, now is the time to do it. It opens November 1st and then it ends January 31st. We do let families know that they should enroll before December 15 if they want their insurance to kick in January 1st. But they technically have until January 31st just to apply through the open enrollment period. Also, special enrollment, we let them know in case there's changes during the year that there are exceptions. Members can enroll if they have a life-changing event, such as losing healthcare coverage, getting married or divorced, changing their income, whether they lost a job or they lost hours at work, such as the case with COVID. And then if they also added or removed children to their family size, they have 60 days to report it. Covered California was very helpful this year with helping with that. They extended the open enrollment period throughout the year because there were so many changes with our families, and going to work, then coming back and not having work, and then changes in hours. So it's special enrollment really helped some of our families with some of the changes and having the opportunity to apply. Next slide. So what we're getting asked in the community too, when clients were calling us saying that they lost their job, is they're offering me COBRA at work. So with COBRA, we were asking how much they were being charged. And we have an example of what COBRA would cost, for example, for a family of 4. So $1,300 may be something that they would charge a family of 4. What we're telling them is you lose nothing by applying for Covered California and just getting a quote. For example, with the first line, like an HMO Silver, that's usually our most popular type of Covered California plan. If a family, for example, makes $38,625, they are at 150% of the federal poverty guideline. They could get a plan around $110 a month. So if you notice buying insurance through work, it's $1,300. So they would actually be saving money when that client has actually lost their job. So we were getting a couple questions regarding COBRA, and it's actually much more beneficial for a family to apply for Covered California than to pay the full amount. With COBRA, the cost depends on your employer. Your employer is helping to pay a percentage of your health insurance. So when you're on COBRA, the member is responsible for paying the full amount. And then we also let families know that sometimes they may be paying more, like 2 to 10% on top of that for an administration fee. So we were getting a couple questions regarding COBRA, and we were telling the families to check Covered California to see what their options are, because in the end, we want to make sure that they have something they can afford. Next slide. So we also get questions a lot about, what does health insurance do for me? Is it necessary? What happens if I don't get health insurance? So we just want to let families know that this year, such as with 2020, in 2021, the following information applies. California requires the individuals to have health insurance, or they will pay a state tax penalty. We usually get asked by families, how much is it? And I can tell them that I can't give you a set amount because it depends on your family size. So it's no set fee. It's basically, the penalty is the higher amount of these two options. So you either pay 2.5% of your total yearly household income. So if that's 2 parents in a household, it's the income combined, or they pay $695 per adult and then $347.50 per child under 18. So like I said, it's the higher amount that they'll pay. So we do let families know they should just reach out to a community enroller, check to see how much it would cost, because a lot of the times we do see that the families can get something for much less than paying the penalty. There are programs to help with premium assistance, which would be they help pay part of the monthly bill through the federal government, or they can get cost share reductions, which helps to pay for some of the services when they go to the doctor too. So special discounts where it covers their services. And then all health plans are helping to give the 10 essential health benefits for families, which includes like maternity services, preventative care, ambulance, pharmacy, mental health. So we do let them know insurance is there to protect you. We usually do community classes and we ask, what type of insurance do you have? And our families will say, I have iPhone insurance or I have car insurance. So we do community workshops to let them know it's the same thing. It's there to protect you. So we give examples, like if they were to break a leg, it can sometimes cost up to $7,500. A 3-day hospital stay on average can be $30,000 for 3 days, so $10,000 a day. If a family member has cancer treatments or a severe illness, those bills can add up throughout the years to hundreds of thousands of dollars. So we just want to make sure that they have health coverage to help protect them and have something that's affordable for them to pay. It will pay for major costs, so they don't have the full balance and they don't have debt. And we want to make sure that they're also staying healthy, checking up with their doctor, going to visits, having vaccines and health screenings. And then it also helps to pay for prescription costs and some of those services for long managing chronic illnesses. Next slide.
And Monica, just a friendly reminder of time.
Okay.
You have 6 more minutes.
Okay. This one is just an example of the income guideline. We just let families know that it is based off your family size and your income. So I just want people to see how high the 600% level is. Like a family of 3 can make 130,000. Most of the families that apply, 9 out of 10 will have some type of assistance. So sometimes the families don't know how high our income guideline is. For types of coverage, this is just example of some of the plans that we have. Also with Covered California right now, our pricing through HealthNet, we are number 2 when it comes to HMO, Silver HMO, which is the most popular. With our Silver PPO, we have the lowest price in Covered California market, and then we also have the lowest bronze. For value added benefits, this is what we're really trying to help families understand. With COVID, some families have told us they're scared to go to the doctor. Sometimes they can't go to the doctor because they have 3 children at home and someone else that they're taking care of. So transportation issues or just not being convenient. So we do let them know in case you can't go to your clinic, there is telehealth. For example, with us, it's Babylon, but every health plan has different programs with different names, but it's similar in the end. So you have access to 24-hour healthcare on your phone. So you can either video chat with the doctor, you can use a 24-hour nurse line, and these come in multiple languages. These are also free. A HEAL program that we have is a doctor comes to your house, the same cost as a copay. So if you're traveling, if you want someone to come to your home, your hotel or office, the doctor can come to you. CVS Minute Clinics, we partner with them, and a lot of insurances have programs where clients can go to other states and see different providers in case they need it. So it's just convenient for you to know that if you're traveling to another state, you have your health insurance to help you in case you need it. Right now, too, with mental health, we do have a lot of families asking questions because services were either cut, maybe some with schools or with nonprofits. So they were asking for additional services during the summer. So we did refer a lot of families to check with their health insurance to see what type of programs and the support that they have. We have programs to help with disease management, with healthy rewards. If they complete their vaccinations for the year, they do a physical, they create a plan with their doctors. Some health plans will give them a $50 gift card just for completing that. We also have health education classes. We tell families to always look online. There's exercise classes, nutrition classes, Zumba classes. We have mental health apps and programs where they can connect and get those resources that they need. We also have a 24-hour crisis line if they need it. And then we partner with Aunt Bertha, which is similar to 211, where they can go online and look for resources that they may need in their community. What we're also doing right now is that we are helping with community workshops. So even though we're not doing outdoor events or in-person events, we do understanding healthcare workshops where we get families asking us questions on even just like how do they make their appointment, how do they find a doctor, how do they find someone in their network, what's included in their health plan, such as the benefits. We help explain what they are, how to use them, just so that they really prepare in case they need to use it. They don't struggle to figure it out last minute. So we help them prepare. We give them advice on certain services that can benefit them in case they need it, such as times like these. We also help with promotional items if you're having a fair, collateral, which would be pamphlets. We have understanding healthcare booklets in English and Spanish, and it just shows them terminology and some of the words that they should be familiar with, because in the end, we just want to make sure any health plan they're at, they just know how to understand what they have. Also, we do community training for community enrollers to help them with understanding our benefits in case their clients need it. We get questions from community enrollers on how to help their clients with certain situations. We are partnering with different organizations to do online resource fairs. We partner with other health net departments. So if you're looking for a workshop on like nutrition, on like we do cultural and linguistics trainings too, where our department comes out to train on different services like customer services, be like improving customer service skills with families, different services to kind of help with staff development. And then we are helping organizations with like webinar support, because sometimes we have one person doing a webinar and we can also help you in case you need an extra person to help you with tech support or just to help with certain things. My information is there down below. So you have my email, my phone number. I do community relations for San Diego and Los Angeles. And then if you have any questions or ways to partner or any ideas, you can always reach out to me. I know the organizations are very creative with ways to reach out to their clients. Next slide.
Well, Monica, you have your 15 minutes now. Let me see. Do you want to do a final wrap up in 1 minute left?
Yeah, so what we usually do for, this is just if you need help, you can reach out to me. But next slide. We do have the community workshops, understanding healthcare workshops, if you're interested. We do them in English and Spanish, and then it's just a way for us to talk to the clients to help them with any questions and just prepare them on how to onboard or use services. So if you have any questions or would like to give it out to clients, you can reach out to me and my information's right there. What we usually do at webinars is that we do trivia. So I know that you guys have a chat box. We usually do 2 Target gift cards. So what I'm going to do right now, I'm just going to ask 2 questions to see if you paid attention. We do it with the families too. Sometimes we'll do raffles or trivias, or just to keep them entertained in the classes. So we're going to use the chat box, and the first person to answer, you will get a Target gift card. So first question is, when does open enrollment end? So if you can type it in, first person to answer, I can email you a Target gift card. Or a Starbucks, if that's what you want.
Wow, that was quick.
So the first completed answer is, I think it's Carmela. So
Carmela Maribao.
So if you can give me, you can either private message me, or if you want to put your email there, I will go ahead and email you a gift card. We have another question too. So the next question would be, what is one of the added benefits the families can use right now during COVID, other than going to a clinic? And they can go by several names.
Oh, so, wow, that was fast.
So telehealth. Pamela makes, Pamela Mesa. And then I will go ahead and get the emails. And then I will email you, and then I'll give you more information. So this is similar to what we do in our workshops. We have to find ways to get the families to be creative because they're telling us they're zoomed out. So we'll play at the games just to make sure that there's retention and they're learning key terms and things like that. So if you guys have any questions, you can always reach out to me. And then thank you so much for letting me present today.
Yeah, thank you, Monica. You kind of got things flowing here with the raffles virtually.
You wake them up with the raffles.
And we're paying attention. So I know my staff will be looking at such options, and maybe I will be requesting some assistance for kind of running this type of more interactive and doing polls.
We can always donate to the collaborative. Just you can do it at the end. I know.
Fantastic. Thank you for that offer. So thank you for your time. And let me close your presentation now. We have now Nancy Saavedra with the Hunger-Free San Diego Nonprofit Navigator program. And Nancy shared with us several handouts that will be in the package that you can download from our webpage. And as presentation, she has given us this PDF. So is it visible? The Hunger Free San Diego nonprofit Navigator program. Do I hear David say yes?
Yes, we could do that.
Thank you. So let's, Nancy, are you there? And just guide me through. You have 15 minutes and just said next slide.
Sounds good. Thank you, Brendaly. Good morning, everyone. Thank you for letting me join the collaborative meeting. This is my first time joining, although it won't be my last. I just joined the Hunger Coalition team in September, so I'm really excited to serve as the community engagement manager for the coalition. Before I start, really,
I think oh, there we go.
Everyone is familiar, but the San Diego Hunger Coalition, we work to build a more effective system of hunger relief programs so that anyone facing hunger can readily get enough healthy food to see them through their time of needs. So that's what I'll be talking about really quick. I wanted to share a few statistics that the team has been working on. And so I'll just share really briefly because this is just one piece of information that I wanted to share with you all. But recently, our team was working at looking at the food insecurity rates here in San Diego County, especially during COVID. And so the goal is to have real-time analysis of COVID-19's impact on food insecurity and look at zip code. You can see this is overall the county, and just we looked at the 3 different months that you'll see: January before COVID hit, April when the entire state was under the stay-at-home order, and then in August when we started to see some reopening across the state. And so you'll see the rates kind of slightly dipping down, but it's definitely still higher than pre-COVID, and it looks like it will continue for the next couple of years, but I'll share a bit more on that. The next couple of slides, yes, thank you. So this is what I mean about the zip code level. Our team is really excited because it's something that we've been wanting to do for a while. We're working with our partners, the food distribution sites, the county, CalFresh, everyone trying to share their data so we can have the most accurate and up-to-date information rather than waiting a few years later where we can collect all of this. And so this is just a geographical map of January. The next 2 slides, if you'd like to go ahead, they show, you'll see as well on the legend, it shows the number of people who are food insecure. And just really briefly, in terms of sources of data, we've been using the current San Diego unemployment rate, the federal poverty level status, and a few demographic and housing estimates so that we can see. Oops, okay, right there. And so if you are interested in learning a bit more about the data, I will include an invitation to our State of Hunger where we'll actually be releasing critical up-to-date data on hunger and food insecurity rates. But the main point of my presentation this morning is to share with you an exciting program that we're leading, which is called the San Diego Hunger Free Nonprofit Navigator. Oh no, Brendaly, you are on the right one. The pie is showing you the different resources that San Diegans can get food. You'll see that a big chunk is federal nutrition programs, which include CalFresh, WIC, and child and youth meals. We've got a few other smaller pieces, but really it's just to show you all that we do have great resources available here in San Diego County, but the issue is having families and individuals access all of this. So the next slide kind of introduces us to our main point, which is that figuring out how to access all of these resources can be confusing. It can be overwhelming, especially someone experiencing food insecurity for the first time. And the Hunger Coalition actually piloted the pandemic EBT program, just sharing the information that was with the new PEBT. I'm not sure how many are familiar, but children, because of the school closures, really quick context, because of the school closures, the government was able to provide some funding. They sent out PEBT cards to replace the school meals that they would otherwise get. And so the Hunger Coalition led this effort here in San Diego County, trying to bring awareness and getting households to enroll. Based off of this, we were just able to validate in the next slide that it is confusing and there is a need to be able to connect families with additional food assistant resources. So not just pandemic EBT information, but just in general. There was a lot of misinformation. There's myths around certain food assistant programs. And so the point of the Hunger-Free Navigators is to help people understand that they are available, helping them feel more comfortable in accessing this information. And we also found out that partners do want to know more information so that they can connect their families to these resources. So it's just a matter of being able to provide the information for both community residents and community-based organizations to be able to feel comfortable making those referrals. So the next slide introduces the general description of the nonprofit Navigator program. And the reason I call it the nonprofit is we're actually developing a community resident version later on in a couple of months. And so I'm hoping to share a bit more information about that as well in the next couple of meetings. But this version is focusing it's focused for nonprofit agencies. It includes a training that will provide a comprehensive overview of all the food assistance resources here in San Diego County. And the idea is to provide a training where staff will feel comfortable in understanding the different programs available and being able to identify which ones are most applicable to the families that they serve, and then feel comfortable and confident in actually making those referrals, or at least knowing the steps to share that information with their clients. So the idea is that after they complete this training, they will be recognized as Hunger-Free Navigators. They will continue to receive email communications. We'll have a web page where we will post up-to-date information because a lot of policies have been changing so far. I mean, school meals they change week by week. So my hat's off to all of the school's nutrition staff trying to provide the school meals. And so those kinds of changes might be important to share with our Hunger-Free Navigators. The next slide I mentioned that this is for the nonprofit staff. The idea is to be able to share these resources to those who are already making community referrals. And we would like to be able to reach as many different sectors in the community as we can. So those who may be working in affordable housing programs, who work in libraries, this is useful information to be able to share with their families. And so that's what I mean about a comprehensive overview of all of the food assistant programs. So there's a lot that we can share, but we want to be mindful that it's not overwhelming for anyone who's interested to be able to learn and be able to kind of revert back the information that they hear to their clients, if that makes sense. So what this training entails, it's a 90-minute, it's all free information and training. We'll be doing them online because of just the situation that we're in. And like I mentioned, we'll be providing ongoing support. So the idea is to build this network of Hunger-Free Navigators where they can share resources or ideas as we also provide more information about policies and changes that affect county-wide programs.
Oops,
So,
sorry.
No, yeah. The previous slide, Brendaly.
Oh.
If we can go back, I think to
Oh,
that one.
good.
Perfect. So what does the content include? We will want to share some of the main programs. So if you remember the pie that I just mentioned a few slides back, we want to talk about CalFresh, WIC, the school meals, and how they all kind of differ depending on the school and even districts. the home delivered meals, commodity food boxes that are available for seniors and other special populations, and then food banks and pantries overall. So we wanted to be able to provide a description of what each one of these are, who is eligible for these, and some initial steps that they can do depending on their region, because it sometimes even varies by city, not necessarily by region in the county. So that's what we want to make sure people feel comfortable learning. So the next slide. So a brief example of this. I can't share all of the wonderful information that I'll be doing on the pilot, which I hope you all are able to join us in on Friday. But this one is a quick breakdown of what resources you might be able to start depending on your clients. So general public, for the most part, CalFresh and food pantries would be a great way to start. CalFresh is income-based, so depending on their eligibility, that would be something to look into. For older adults and people with disabilities, you can see the little list of CalFresh home-delivered meals, the senior commodity food boxes and food pantries as available resources. And then for children, we've got a few more options that you can look into. So this is just a quick snapshot of what we're going to break down in our training, but I wanted to make sure that this is available to you all as well. The next slide, I believe, is just the flyer that I think I also attached. So you will have this. We just updated it this past week with the new changes on CalFresh and a few other tidbits. One thing that you may have already heard or may not have known, CalFresh right now, because of COVID, is providing the maximum allotment to all families. So if they had applied in previous years and they only got those minimum $16, they'll actually be getting, I believe it's $200 in their maximum allotment. So those little changes, I think, is what's important to highlight and what we'll be sharing continuously with our partners. These are flyers that are available to you all in the list that Brendaly shared with us. And lastly, I wanted to invite you all. We're piloting this 90-minute training this Friday. We wanted to have a small group so that we can get the feedback as to whether the information is useful, what else we would need to provide for everyone. So if you do have a chance to join us, I would love to be able to get your thoughts. We will be providing other trainings after this pilot once we're able to get down the information that we want to be able to share with everyone. But I wanted to be able to extend this to the collaborative and our partners to see if anyone is interested. This is the first come, first serve. We have a few slots open still, but we definitely want some representation from South and East regions to be able to make sure that the content is something that you are all interested in. This training, this program is all for our partners. So I would love to be able to get your thoughts. If you do have any questions, I have my email there as well. I'll also be sharing the invitation to our State of Hunger event next week. If you have any questions about the Navigator program or the State of Hunger, please let me know. I would love to be able to partner with you if you think that this training might be helpful for your staff or other partner meetings. I'm very excited to be able to share this with the community. So thank you again for the opportunity. And if you have any questions, I'll be able to chat with you throughout the meeting as well. Thank you all.
Thank you, Nancy. I do appreciate your request for our involvement in the pilot phase of the program. I have spent years back in Florida developing this type of programs for promotores and community health workers and other stakeholders. And we really value when we're putting something together, you do want to get feedback, you want to see the responses, how people find it useful, and even making suggestions and recommendations to improve on it. So I just wanted to underscore the importance of this opportunity to provide feedback for a training and a slide set and handouts and all that it comes together in a package for education and to our partners. So thank you, Nancy, for that invitation.
Thank you all. And I'll just, if I can add really quick, I didn't even go into the community resident version, which is, we will be starting from scratch basically because we do want to know what barriers our families are facing, what cultural considerations we need to have. We anticipate having different versions depending on our target audience.
Sure.
So I mean, if that's something that people would have any thoughts, I also welcome them to email me as well. So thank you.
Thank you, Nancy. So now to my next Nancy today. We're going from food insecurity to now a broader issue that really the pandemic has really highlighted the needs and the gaps there in terms of the support that is needed. I mean, we all in April, in March, April, May, we were already kind of in high alert, but going on in a period, and it's sometimes very overwhelming, not only to our families, but also with the staff. And when you're providing services, when you're there on the line, front line, being assistant, in whatever role you play, that takes its toll. So we want to empower our staff, our team members all across the board to be stronger, to work through our own issues, and face, mental health first aid is a response to that. I am familiar with this project since my years in Florida, and both the English and the Spanish version. And I welcome the opportunity to learn more about what's happening here in San Diego regarding mental health and this first aid program. Let me invite Nancy Machuca. Nancy, are you there?
Yes.
Here it is.
Thank you.
Just like previous speakers, you have 15 minutes, and let me put this on slideshow, and you'll let me know when to move it forward, saying next.
Okay. Good morning, everyone. My name is Nancy Machuca. I'm a certified bilingual instructor for mental health first aid, and I work for Mental Health America. And now that we have all this situation with the COVID-19, we think that it's very important to have this training. Let me explain you what is mental health first aid and why mental health first aid. Next. Okay, what is mental health first aid? Mental health first aid is the help that you can offer to a person who is developing a mental health problem, meaning that maybe that person is developing anxiety, maybe depression, okay, or experiencing a mental health crisis. What could be a mental health crisis? Anxiety attacks, panic attacks, suicidal thoughts, self-injuries, okay? And the first aid is given until appropriate treatment and support are received or until the crisis resolves, meaning that it will be sometimes that we can help and solve the crisis, like we can de-escalate a panic attack or de-escalate an anxiety attack, but it will be another time that we need to call for professional, for the 911. It's like having the CPR when it's had a car accident and you're there, you're helping to do CPR, but when the paramedics gets there, you step away and you let the paramedics to finish. The same thing here. You help the person, then you get the professionals to finish the job when the person needs more help. Okay, next. Why mental health first aid? Okay. Mental health problems are common. Everybody knows at least one person with a mental health problems, one person with depression, one person with anxiety, one person with panic attacks. So mental health problems are common, but if mental health problems are common, why do we still have the stigma associated with mental health problems? What do you think, and this is a question for you group, why do you think we still have the stigma on it? If the mental health problems are common, why do we still have the stigma? Why nobody wants to talk about mental health problems? Why, if I need to go for therapy or I need to go with a psychiatrist, I don't want anybody to know that I'm going with a psychiatrist or going for therapy? What do you think? Anyone?
Well, there's fear of judgment.
The fear of judgment.
People are afraid that if their employers know, they might think that they can't do the job.
Yes.
That they're going to, seem weak, that it's embarrassing, that they're just, because nobody talks about it.
Exactly.
So we all know somebody, but it's, secret.
Yes.
Somebody just wrote cultural, and that is super true.
Yes.
Just cultures, it's, rub some dirt on it. There's nothing wrong. Just keep going. So you don't even bring it up.
Yes, that's true. Thank you, Andrea. That's true. And you know what also is the labeling? Because when we see someone who is going for therapy with a psychiatrist with a mental health problem, we say that person is crazy. And we put the label right there. Okay? So why also we need this mental health first aid? Professional help is always on hand. And when we say this, we say it because, for example, maybe they don't have any type of insurance. And if you need to pay for one, at least it's $150 per session. Or maybe you have insurance, but the insurance, let's say, it's just an example. Let's say that the insurance will pay 5 or 10 sessions and you need more. Okay? So you need for the insurance to approve the extra sessions in order to continue with the treatment. And sometimes the insurance pay, you have all the treatment, but there's not enough professionals to provide therapy. For example, I just had a training last week, and I have a person who is in a really very delicate situation. And she was telling me, I need to see my therapist at least once a week. But they don't have any appointments available until a month and a half. That's why we say that professional help is not always on hand. We can have a lot of resources. We can have a lot of maybe 1-800 crisis line, but sometimes when they need to be seen by a professional, it's not always on hand. Okay? And individuals with mental health problems often do not seek for help. I know that I have depression. I know that I have anxiety. I know that something is going on with me, but I don't go and look for help. Do you know what is the average? How long? How many years it's the average for a person to go and look for professional help? Speaking about mental health, the average 10 years. That is the average that the people wait to go and look for professional help. Okay? Many people are not well informed about mental health problems, and many people, they don't know how to respond. When someone with a family member or friend, they have an anxiety attack, a panic attack, or suicidal thoughts, they don't know how to respond. They don't know what to do. Okay? That is the reason that it's very important to have this training about mental health first aid. Next. Could you please go to the next, Brendaly? Thank you. When you attend this training, we teach this action plan. We teach how to recognize signs and symptoms for a mental health problem, but also we teach the action plan, what to do in case of, okay? We don't teach it, when you're taking this training, you're not gonna diagnose anyone. This is not to diagnose, this is just to recognize those signs and symptoms from mental health problems. And then we teach you an action plan, what to do, what are the steps that you need to do in order to help someone. The first step is assess for risk of suicidal harm. What do you need to assess? When you're helping someone, you need to assess your surroundings, but also you need to assess if the person, your family member, your friend, is for risk of suicidal harm. The next step, the next step is listen non-judgmentally. Once I get there, let's say they say, you know what, we have a person in that room that is having a crisis. The next step, you go and check. The first step, you go and check your surroundings and check the assess for risk of suicidal harm. The next step is listen that person. Listen non-judgmentally. What do we mean by listen non-judgmentally? Is listen not just with your ears, but also listen with your body language, with your facial expressions. Okay? How do you know when someone if you're having a conversation with someone, how do you know if that person is judging you or not? With the facial expressions, with the body language. Okay? Because let's say, for example, there is one person that's telling you, and let me see if I can put my camera on just to give you an example of this. Yes, let's say that you have a friend that is telling you that he's been thinking about suicide. And then you're talking to the person, and the minute that the person is saying, I'm thinking about suicide, and you make like this, or like this, or like, oh my God. All this, believe it or not, all this could be judgmental. And you can miss the only opportunity to save the life of that person. That's what we say, listen, not judgmentally. The next step, now you listen, the next step, and how you can give that reassurance and information. You will give reassurance to the person. Everything is going to be fine. I will be here for you, and set information. It doesn't say giving an advice, just giving the information that the person needs. And then encourage help. It doesn't say tell the person what to do. It doesn't say, you know what, friend, you have all the signs and symptoms for depression. You need to go for therapy, friend, okay? What that friend will tell you, I'm not crazy. You go first and then I will go, okay? So it's encourage. And we teach you how to encourage someone to go to look for appropriate professional help. And the last one is encourage for self-help and other support strategies. What other support strategies can we encourage that person? Okay, next. So where the mental health first aid can help? Okay, what is the spectrum? The help on the spectrum of mental health interventions. Everybody, all of us, we do all prevention. Every day we do prevention. Okay, but when that person, my friend or my family members, is becoming unwell, we need to do an early intervention. When we say an early intervention is encourage them to look for professional help. But it also said that we're going to do a little bit in about treatment on the way from the unwell to the recovery. So what is that help that I can provide to that person when they're on treatment? If we're not professionals, well, we need to encourage them to finish the treatment. We need to encourage them to take the medication, because sometimes it could be someone that is diagnosed with depression, and the doctor say you will be 8 months on medication, and then on the month 4 or the month 5, they say, you know what, I'm feeling well again. I take my life again. I want to do a lot of things. I don't think I need this medication, and they stop the treatment. So we need to encourage them to finish the treatment. Why? For example, one of the crises for people with depression, when they're the type of crisis that they have, it could be suicidal thoughts. So that's why it's very important to help them and to encourage them to finish the treatment. Okay, the next one. Okay, what is the audience about on these trainings? We provide these trainings to general community, higher education, social services, primary care, law enforcement. We have one of our colleagues is a retired police officer. So he's in charge to do this type of training to the law enforcement and public safety. We have been teaching in faith communities, youth-focused entities. We teach parents, we teach in schools, to counselors in school, to teachers, general community, anyone above from 18 years and above can take this training. We have the mental health for adults trainings. We have the mental health first aid for adults who's working with youth. We have the older adults. We have the veterans, trainings for veterans. We have the training for the law enforcement. So we cover all the audiences. Next. I can see. Okay. Can you do the next to see? It needs to be some messages on that slides, Brendaly. Thank you. So mental health first aids increase the knowledge and understanding. Why? Because after this training, for example, when we talk about depression, a lot of people know what is depression, but do we really understand what is depression? Do we really understand someone with depression? So this training increases the knowledge and understanding. Next. Encourage people to help other people. I have in one of my trainings, one lady that was saying me, my neighbor has depression. Now that I know all of this, I will go with her and take care of her kids so they can have some rest. So encourage people to helping other people, supports people from getting help. We provide a lot of resources. At the end of the trainings, we provide resources from all over the county. And sometimes we provide resources from the border because we have participants who works here and also live in Tijuana, for example, and sometimes they request some type of resources on the other side of the border. They increase the mental health awareness. And the last one, increase mental health wellness too. Okay, so to schedule a training, you can log on to our website or you can contact me. This is my email. I don't add my phone because we usually on trainings every day. So it's very difficult for us to answer a phone call. So that's why we always give the emails. So we give you a certificate that is valid for 3 years. It's like when you're taking the CPR class and then give you a card that is valid for 2 years. We give you a certificate that is valid for 3 years. So this is very important. We are getting really close to the holidays. The seasonal depression is getting high. It's very, very important to be able to help our members of our family and how to recognize signs and symptoms and give all the support regarding the mental health. So thank you, Brenda.
Yes, indeed. And actually, many of my staff have taken this course in years past. We plan to have a session only in Spanish for a smaller group of other staff. So I encourage everybody to contact Nancy and take a look at their offerings virtually, and all the resources are available around mental health first aid course. Thank you, Nancy.
Yes. Thank you, Brendaly. Just one more thing. The training is about 8 hours and we divide it in 2 days, 4 hours one day and 4 hours the other day. But you can email me and I can give you all the details about the training. Thank you so much for the opportunity to share.
Yes, indeed. Important for scheduling, especially when offering as part of professional development for staff. And let me see, I think that we have covered our presentations for the morning. We have time for the next section on information that partners would like to share with the other attendees of this call today. So I will open the floor And also you can use the chat to leave either contact information or share links of your program. We will, again, put all these presentations together, all the handouts that the speakers have provided and mentioned, referenced in their presentations, into one full package. We're going to upload later today this audio recording of the call and all those attachments and slides. So those will become available later today at our website. Opening it up.
Okay, this is Andrea Martin from the South County Career Center.
Hello,
Hello,
welcome.
everybody. It's been a while, so I'm so happy to reconnect with everybody. I sent you actually a 4 new flyers to your email. If you can.
I'm sorry, we lost you.
Here we go. Sorry about that. I just wanted to share with everybody that even though our physical offices are closed, we are continuing to serve our clients between EDD in the building and KRA. We are still helping. A lot is just over the phone and and just Zoom meetings and things like that, but we are able to enroll new members. We've received 2 new grants that we are super excited to share with the community. One is for people that have right now are making at least like 50% usual salaries because of COVID. We're able to help them with up to $800 in bill payments, either rent or utilities or even equipment to be able to work from home. We also received another grant to help place displaced clients. So that's more of a boot camp section. Also, the Workforce Partnership right now has Hire for Tech that only works for Chula Vista. So that's why I want to make sure you guys get that flyer and we can send clients over there. But you know, if anybody, I'm going to put my information on the chat. If anybody has any clients that you want us to help out, please send them over our way. That is the one thing we're having a challenge is finding all the participants. And I know everybody needs our help. So I'm going to stop because I know it's a lot of people. And I'm just going to put my email on the chat. And then hopefully you'll get all the flyers that I sent out. Thank you.
Thank you much. We have several hands up. Let me try to navigate this panel here. We have Emma. Do you still have your hand up? Okay, Matthew Hogg, CSA San Diego. I know Matthew had forwarded me a flyer for an event, and it will be included in the attachment folder of this meeting regarding an incoming event on rentals. We have another hand up, Aaron Gutierrez.
Hello, everyone. So my name is Aaron Gutierrez, and I'm actually part of the UC San Diego Antiviral Research Center. So I just wanted to promote the COVID-19 vaccine trials that are actually taking place in the South Bay and one in Chula Vista on 3rd Avenue. So if you know anyone that's interested, or if your organization is actually interested in receiving a presentation more about education regarding the vaccine trials, just reach out to me. I'll give out my email and my the website for our COVID-19 vaccine trials on the chat. And just let me know if you have any questions or if you're interested in the presentation. Thank you very much, everyone.
Thank you, Aaron. We have Carlos Alessandrini with the hands up.
Good morning, everyone. My name is Carlos Alessandrini with Family Health Centers of San Diego. I'm a health educator nutritionist. And right now I am promoting the Lead Awareness or program. In a few words, we're trying to educate the community as much as possible. So there's a couple of presentations that I'm pretty much giving out throughout the month. So I'll send those to Brendaly, if she doesn't mind emailing me blast. And I will take advantage of doing another plug for an organization that I'm working with, which are called Miracle Babies. They're located up north, but they have actually doing diaper drive-throughs, and one of them will be held this Saturday in the National City Library. It's absolutely free. They do ask for to sign up prior to, and they're actually giving out different sizes from 0, 1, 2, all the way up to 6. And again, absolutely free. I'll pass it on as well to Brendaly, and thank you, everyone.
Thank you, Carlos. Next. I went over all the hands out. Maybe they came back, either Emma or Matthew or, oh, now we have another one, Violeta.
Hi. Sorry, can you hear me?
Yes.
Okay, my name is Violeta Gonzalez and I am a promotora for Southern Caregiver Resource Center. I'm going to attach a link in the chat box. If anyone has a referral, if anyone is taking care of somebody with dementia or Alzheimer's, they can sign themselves up so they can receive free resources from our from Southern Caregiver Resource Center. And basically, we have open classes in December for family caregivers of those individuals. And if you have any questions, you could contact me, and I'll leave my contact info in the chat. Thank you.
Thank you, Violeta. Do we have another?
Good morning. Can you all hear me?
Yes. Who are you?
Oh, good morning. This is Emma O'Brien with South Bay Community Services. I tried to share earlier. I don't know what happened. I was muted or something. But I just wanted to share. I did get information. But I'm with South Bay Community Services, and I'm our Youth Emergency Outreach Case Manager. So I support, as well as the programs within the program I work with, support youth 18 to 24 or 16 and 17 if legally emancipated who are experiencing homelessness in the South Bay. If you'd like any more information about how to refer youth, information on specific resources or supports that are given, or also be added to the monthly email list that I'm sending out with resources and flyers and all those good things, please send me an email. My email I put in the chat. It's eobrien@csbcs.org. Again, it's in the chat. Thank you.
Thank you, Emma. And just like Emma did, if you have an opportunity to share your either email address or link to your program or your organization, please do so in the chat. It's going to be recorded, so will be accessible for those that take a look at this recording later from our webpage. We have another hand up. Marco Lemus, please.
Everybody, good morning. My name is Marco and I work for Catholic Charities at the Immigrant Services Department here in San Diego. And I want to let everybody know that our Chula Vista office, which is located off of 8th Street, where St. Rose of Lima Church has reopened for in-person services for those who would like. We are taking all the right safety measures for that. So we're doing temperature checks. We've added glass, sanitizing station, and many other things. So citizenship, looking to petition for a family member, DACA renewals, among many other things, we can help with that. And also next week, we are having a couple of virtual citizenship workshops in both English and in Spanish next Tuesday, November 17th, and also next Thursday, November 19th at lunchtime, and then also during the evening time to accommodate all the people who have different work schedules. So we used to do these a lot at churches and with partner or organizations, but with COVID, unfortunately, that couldn't take place. So I'll put my email in the chat box, and it's mlemou@dsd.org. Thank you very much.
Thank you, Marco. I know that many of my staff diligently work and send many referrals every month your way because Catholic Charities is one of our direct service delivery partners. So we thank you for that and to your organization. Let me see who else has their hand raised that hasn't gone yet. Did Matthew came back? Oh, are you there, Matthew? Hold. You're on mute, just FYI. Oh, we have another hand up, Miguel Rodriguez. Miguel, you can share with us now and unmute yourself. Okay, maybe that's from an earlier time on the call. Anybody else? Another announcement? I know that the chat log has been busy and fired up with all those links. So appreciate the information. Our next call is on December the 8th. And we have shifted, as you noticed, we have shifted gears from Skype to Teams. I think this platform supports more of the interaction and the work that we plan to do. As a follow-up to this call, you will get that link for downloading all the slides and the handouts that were referenced to today that the speakers have made available. And also you will receive, if not today, because I don't want to stop your interest, immediate return with all the slides and the lot, but maybe after the incoming Veterans Day holiday, you will receive a survey link from me very quick, just like 3 or 4 questions, no more than that, asking your feedback and input regarding our collaborative and planning for 2021. I know that everything is kind of on with a asterisk because we are really responsive to what is happening around us, but we do have to think of, okay, a new era, a new environment within COVID-19 and still working and servicing our clients and families and communities in South Bay area. So with that, I really want to thank all the presenters and everybody that joined us later. Please check the chat box for links and email addresses of fellow attendees. And we really thank your participation and hope to continue having the trust and sharing your commitment to serving our communities. So thank you, everybody. Have a wonderful rest of the day, the week, and enjoy Veterans Day. Meeting adjourned.